Hi, how are you?
Hi, I'm doing good. How are you?
I'm good. I'm good. We love
Yeah.
technical difficulties, but thank you so much for taking the time to be here. We touched base a little while ago on the phone, and I emphasized the fact that one of the major reasons that I wanted to bring you on is that your depth of expertise when it comes to you're a registered dietitian first and foremost, and your expertise around food, nutrition, and holistic healing of migraine, I think is really special and really valuable to a lot of people that if they're either on the eastern or western side, regardless of the avenues of treatment that they're seeking, sometimes I feel like dietitian and nutrition is kind of in the middle and it can get missed. And so I'm really excited to have you on, and I have lots of questions that I'm excited
Yay.
to dig into. And I think just to take the plunge, I would love and I would be excited for us to talk about just general associations between gut health and migraine and the signs of when your gut is a little out of whack, as you so often say, and
Yeah.
how that can impact all of your health, including migraine.
Yeah. Yeah. So there are some more like traditional associations between migraine and gut health and like gut imbalances. And one of those that can definitely affect our the functioning of our medications that we take is delayed gastric emptying or gastroparesis. So that's something that we see a lot in people who have migraine, and it can affect a lot of things, including the ability of their medications to work for them. And then there is a pretty strong association between IBS and migraine or irritable bowel syndrome. And irritable bowel syndrome is a tricky condition in itself, just like migraine is. So we know that there's a strong gut brain connection. So it kind of makes sense that we would see issues like IBS happen more often in people who have migraine. And then there's also celiac disease, which is a where you can't have gluten, you have a significant reaction to gluten, and that is seen more often in people who have migraine as well. So lots of links, and then there are more being uncovered all the time. So
Like you said, IBS, delayed gastric emptying, also peptic ulcers, I believe there's an
Mhm.
association. And so there's each one of those has a long list of symptoms to look out for, essentially. And I don't know that
Yeah.
it'd be valuable for us to list them, but what are some of the signs, maybe on the side of, we're talking about medication or food intolerances, that would encourage people to maybe start looking at their gut health?
Yeah. Well, and I want to touch on peptic ulcers first, or stomach ulcers first, because that is potentially one of the more urgent complications that can be seen when we're talking about gut health and migraine. And one of the reasons we think there's a higher association between stomach ulcers and people who have migraine is because of the medications that we inevitably have to take to control our symptoms, which is totally understandable. I have been down the stomach ulcer route myself, so there's no shame in developing that. But that's one of the biggest reasons we need to be really careful when we're taking over-the-counter pain medications like ibuprofen, naproxen. Those NSAIDs, or non-steroidal anti-inflammatory drugs, are really abrasive and hurtful to our stomach lining and our esophagus. So that's why over time it can cause us to develop some of those stomach ulcers, or even just gastritis, which kind of comes before a stomach ulcer and is just irritation and inflammation of the stomach lining. So when you need to consider talking to your doctor about that is if you're experiencing any upper GI, so kind of stomach area discomfort. So that's going to be like burning or pain or other like uncomfortable symptoms in your stomach area or higher up, because that's something that can get serious pretty quickly.
I think it's really
Um,
important to emphasize that, just
yeah.
piggybacking on the peptic ulcer, because I myself took Excedrin almost every day for a series of several months when I was in high
Yeah.
school trying to just squelch the migraine attack. And then I ended up having a stomach infection of H. pylori. And then now I have general stomach inflammation. And like you
Yeah.
said, it's pain with laying down. High waisted pants can sometimes really irritate it. Anything that kind of sets the stomach off is, and spicy foods, all of that even sharp foods, weird things like that can really be an irritant now. And
Mhm.
I think that when, excuse me, I think that when you have an over the counter medication, people look at it and think, well, it's over the counter. They can't be that serious. There can't be that many adverse side effects because then it would be so much more controlled from behind the pharmacy counter. And that's not the case. But that's
Mhm.
definitely what I thought as a young teen who was just trying to manage pain.
Yeah, me too. I went through the exact same thing, and I think that's a lot of our stories. And even H. pylori, which you mentioned, has an association with migraine. So yeah, we see these things so commonly, but I think they're often overlooked. So if you're, kind of getting to a place where your migraine isn't responding to, traditional treatments, kind of digging deeper into gut health and some of these issues that we've already talked about can be a really good next step to help you not only hopefully see some improvement in your symptoms, but it can also help your medications work better if you're able to absorb them better, which is good too. Yeah.
Exactly.
Yeah.
When I was looking through some of your posts and when we talked the other day, one thing that you said is that if your oral medication is almost entirely ineffective or way less effective than you and your doctor had anticipated, maybe that's a good sign to start taking a look at your gut health.
Hmm.
And I think it's important to remind people that we talk about the gut brain connection. We know there's the vagus nerve. We know that a lot of neurotransmitters and other hormones that transverse up into the brain are produced in the gut and are synthesized in the gut, in and around the gut. But the exact mechanism of how those gut disorders are associated with migraine, we largely have no idea. And hopefully we'll have some idea soon. But just knowing that there is this association, I think can be helpful for people to at least start tracking in parallel their gut symptoms with whatever they're managing, migraine, maybe it's some other neurological disorder, whatever it is, but tracking the symptoms in parallel, I think can start to help connect the dots either for you or for you and your doctor and your treatment team. And starting to that essentially tracking gut and brain already pulls you into the sphere of holistic healing and looking at your entire body, which is important. As you've said, and as I've said several times, migraine is an entire central nervous system disorder. And it's not like migraine ends at your neck. It's not cut off and then the rest of your body is totally independent. It's entirely connected.
Yeah, exactly. I say that all the time. Like, we've got to stop treating migraine from the neck up only, because it is a full body condition, especially when we start to look at the gut and its connection with the brain, like you said. And we really can see some improvements there. I mean, that's largely how I work with my clients is through the gut. And that can have a profound impact on not only our migraine, which is usually our biggest kind of barrier that we're trying to overcome, but your health as a whole, which is so valuable. Um, but did you want to talk a little bit more about like IBS and that end of things? Because we kind of talked about upper GI, but not
Mhm.
lower GI as much. This is an area where the research kind of starts to fall off a little bit. We do have a decent amount about, H. pylori and gastroparesis and other things, but IBS itself is kind of mysterious in a way. So there are a lot of conditions that we can see behind IBS, like an overgrowth of bacteria, overgrowth of yeast, something called increased gut permeability, which you may have referred to as like leaky gut before. All of these things and more can be seen with IBS. And more we're seeing that these conditions can also impact migraine and the brain. So there's some really fascinating research around like our microbiome and the composition of the bacteria in our gut that we want to be there. It's good gut bacteria. And how the composition of that bacteria may play a role in the progression of migraine or the existence of migraine. Still need more research to firm that stuff up, but it is really fascinating to look at and consider, wow, if we, really try to support our gut health by even something as simple as increasing fiber intake in the foods that we eat, it can have an impact on migraine, even if we don't know exactly how it's doing that yet.
Right. And
Yeah.
one thing, and maybe this is, I would assume from what I know about my friends with IBS and their issues with food and getting enough nutrition, and malabsorption is a pretty big problem when your gut is so inflamed. And so when you have these GI syndromes and inflammation, you have potentially an altered microbiome. And between the inflammation and the altered microbiome, food may not be as well absorbed. And then you can have deficiencies in nutrients, critical nutrients, and then that may in and of itself be contributing to your migraine attacks and your migraine disease.
Yeah. And I'm so glad you brought that up, because micronutrient deficiencies or vitamin and mineral deficiencies are so overlooked. And y'all, it's as simple as running a blood test oftentimes to uncover these things, and then using appropriate supplementation paired with maybe optimizing your diet and definitely looking at gut health and seeing what we can do there to increase absorption can have a big impact on your levels of pain or your levels of symptoms if pain is not one of those. And a lot of micronutrient deficiencies are linked with increased migraine symptoms. Vitamin D is a really big one right now. Vitamin D is becoming more and more popular. Magnesium, we all love magnesium, but we know that a magnesium deficiency can contribute to migraine. And magnesium in particular seems to impact people who have hormonal migraine too. So it seems to be especially helpful for those of you who notice like a cyclical pattern to your symptoms. But yeah, it's important to remember those root causes when we're trying to heal things like micronutrient deficiencies, because like you said, if you've got an absorption issue, taking supplements may be kind of a band-aid for addressing the actual absorption issue, so you can start absorbing nutrients from your food and supplements.
Yes. And one thing
Yeah.
you mentioned was root cause.
Mm-hmm.
And could you elaborate on, you take a root cause approach to food sensitivities? What do you mean when you use that kind of language?
Yes. So I like to, anytime I talk about root cause, I try to make sure that we are all on the same page with, we don't know what the root cause of migraine is. That's a big reason why we don't have a cure for migraine or an amazing treatment that works for everyone for migraine. But we do know there are some root causes to underlying conditions that can make migraine more difficult to manage and make medications not work as well, kind of the things we've been talking about. So a root cause is really something, it's an underlying condition or an underlying imbalance or something that's just not working quite right, that's contributing to other issues throughout the body. So that's a big part of my practice as well, is trying to uncover some of those root causes so that we can help improve them or fix them so you can feel a little bit better.
Right. I think that is really critical when you don't even know what the root cause, quote unquote, is of migraine, but you know things that can be contributing to migraine. And then you can get to the kind of base point of how those are starting. So you can dig into the quote unquote root of maybe something of a contributing factor. It's an indirect way, essentially, of targeting migraine, but it's kind of all we have right now.
Right. And, we all know this at this point. Migraine takes some experimentation. And sometimes, we don't necessarily know the exact mechanism of why something works, but we know that it works. And we can continue to do research to help figure out the why. But I think a lot of us with migraine would prefer to do a little bit of experimentation and see results rather than wait, 30, 40, 50 years for the perfect research to tell us why it's working. Although it is still important to have some science backing up what you're doing, which is...
You're speaking to a scientist at heart. I fully agree. And that sentiment applies to supplements and nutrition and also the pharmaceuticals we take. We don't know why a lot of these, drugs, even the newer CGRPs, we don't exactly know how they help migraine. But the millions of people who are finding increased quality of life on these medications are not going to wait until we know the exact mechanism, as you've said. And okay, so we've covered the broad association between gut health, some gut syndromes, and migraine. And now I'd like to step into different ways that you can use to address your gut health. And I think before we dig into this aspect and this kind of terrain of health nutrition, I would like to start with defining what is the difference between a trigger food, a sensitivity, and an allergy.
Yes. Ooh, I'm glad we can talk about this. So, there are a lot of different what we call adverse food reactions. And there are even more than you just mentioned somehow. There are so many different types of adverse food reactions. The ones that we probably talk about most when we're talking about migraine are those ones you mentioned. So, a food trigger, a food sensitivity, and then food allergies could come into play, although they tend to be more severe reactions. Like you think of someone with a peanut allergy, they cannot eat peanuts. They may not be able to be in the same room with peanuts. So that's pretty severe.
Mm.
Um, but a food trigger, if we're talking about a migraine food trigger, so, red wine, aged cheese, chocolate, those kind of like stereotypical triggers, those are not an immune response. So your body is reacting to them in a different way than you would like a food sensitivity or a food allergy, which is an immune inflammatory reaction. So with a food trigger, it may be affecting your like vasculature. So it may be causing some blood vessel dilation or constriction, which could impact migraine. Um, and some of the chemicals behind those food triggers are thought to be like nitrates, histamine, and other like food chemicals that can contribute to some of those alterations in our blood vessels. So triggers don't have great science behind them. But to be fair, studying food triggers is pretty tricky. So it's really important, I feel, if you're trying to figure out food triggers, migraine food triggers, to really pay attention to how these foods feel in your own body and how your body reacts when you eat them, because our response to these foods is going to be very different from the next person's responses. So that's where, unfortunately, keeping like a food diary, a food and symptom journal can be helpful to really try and get some data as far as how your body is reacting to these foods. When it comes to food sensitivities, we can actually gather some objective data when it comes to these by using functional lab testing. There is no like perfect food sensitivity test out there. So it's still really important to follow an elimination and reintroduction protocol based off of your food sensitivity test results. But we can test for them, which is nice. Whereas food triggers, as of now, we can't really test for those. It's really just kind of trial and error.
Excellent.
Yeah.
You highlighted two things that I now want to zero in on. The first being elimination diets. And elimination diets, I always like to preface with it's the elimination and reintroduction of foods. It's not the entirely restrictive, you can only eat these three foods every day. And I think the focus really starts out on what to eliminate. And then sometimes people get lost with the whole concept of reintroduction. And so let's, I guess, first introduce the concept of what is an elimination diet and why do they typically help people?
Yeah. Well, and even before I get into that, I like to emphasize that this is not the only way. And if you do not like the idea of restricting foods or dieting, or if you have a history of an eating disorder, you do not have to go down this route. There are a lot of ways we can approach migraine nutrition. This is just one of them. But an elimination and reintroduction diet, the goal is to, in the elimination phase, remove all potential foods that may be causing you symptoms. Or if we're talking about food sensitivities, removing all potential foods that may be contributing to inflammation and an immune response. So that phase, depending on who you talk to, lasts anywhere between a few weeks and a few months. But usually what we're looking for is an improvement of symptoms and then kind of a plateau. So you're looking to reach kind of your baseline when it comes to food reactions. Once you've noticed some improvement and kind of reached a plateau, that's when we would want to start adding foods back in systematically and one at a time to figure out which foods you're actually reacting to. So the goal is to not eliminate, like you said, all of these, potential food issues or like unsafe foods forever. We want to add back as many foods as possible, and also figure out maybe your reactions to foods are dose dependent. So maybe you can have chocolate every so often, but not every single day, and be okay. Same with food sensitivities. Maybe you're sensitive to romaine lettuce and you can have it, a couple times a week, but not every single day. Or maybe you can have it every single day. So that's what an elimination and reintroduction diet helps you do. Really gives you information about how these foods impact your body and how you can eat them in a way that avoids total restriction forever.
This plays into the concept of raising your threshold, and your program is raise your threshold. And the threshold theory, to recap if anyone is not particularly familiar, is that there are several things throughout your day that could contribute to an attack. And it's a summation. It's not just, oh, this one bar of chocolate is going to take me from a 0 to 100 as far as an attack. And so say your threshold is somewhere around 80, just to use numbers. Yeah. And so everything throughout your day, from your sleep quality, your caffeine, your whatever throughout your exercise, the exposure to sunlight, fluorescent light, computer time, all of those are being added together. And as long as they stay under 80, if that's your threshold, you will not experience a migraine attack that day. This is very simplified, but this is generally the theory.
Yeah.
And typically what happens is that you go throughout the day, say, I haven't had good sleep, I had too much caffeine, and I've been staring at my computer all day, and then I go out for a jog. If that jog is then exactly what I believe, or if I go out for that jog and then I experience a migraine attack, I'm going to attribute that attack specifically to going for a jog, when in reality, it was the summation of everything that had happened throughout that day. And what the elimination diets, from my perspective, do and allow people to do is pull back the layers of all the summation triggers in from a food perspective and figure out specifically which one is contributing to that additive effect and which ones are not.
Yeah. And I think it also helps to have threshold theory as a whole in mind, not only when you're approaching food sensitivities or an elimination diet, but when you're approaching any therapy for migraine, because we've got to remember it's not just food and it's not just exercise. It's not just, fluorescent lights or whatever. It's everything. So you may not notice that your migraine episodes completely go away after dealing with food or food triggers or food sensitivities. There are other things contributing to your overall load, which is good and bad, right? Because it can get kind of overwhelming when we have so many options, but it's also, at least on my end as the person who can help people through it, it's exciting because we have so many options and options for improvement, which is the good part.
Right.
Yeah.
And from your perspective, I have a theory, but I'm curious to see what your thoughts are. Why do you think elimination diets and I guess elimination diets work for some, but not everyone, assuming that they follow it strictly and assuming all of those adherence factors are at 100? Why do you think they work for some and not others?
Okay. I feel like I have so much to say on this. So to keep it brief, when we're talking about food triggers, so not sensitivities, not an immune reaction, not everyone has food triggers. And there are also factors that we think may contribute to whether or not we react to certain food chemicals like nitrates. Part of that may lie in our microbiome, which is kind of cool. Like if we have too much of certain bacteria, I think there's one study where people with migraine appear to have more of certain bacteria in their mouth that kind of contribute to our experience with nitrates, which could make that a trigger for us, but not people who don't have that huge load of that bacteria in their mouth. So it could be multiple reasons why a food trigger Elimination diet like Heal Your Headache or another protocol may not work for you. It could also be that you have food triggers and food sensitivities. So maybe you've eliminated some foods that cause you problems, but not others that you just don't even know are a problem. And then with food sensitivities, it could be, if you follow your protocol perfectly, you eliminate all of the foods that are causing you inflammation, and we don't see improvements, there could be something else going on. It's just not kind of getting you below your threshold yet. Those
Excellent.
are my thoughts.
Yes. My biggest theory around this is the gut microbiome, which you touched on. And there's not enough research to really focus in on this as a topic, but I think that this is going to be one of the biggest areas of research moving forward in the next 10 to 15 years, is figuring out the gut-brain connection through the microbiome, through the vagus nerve, and how that contributes to general brain health and what you would call brain dysfunction, perhaps with a central nervous system disorder like migraine. More to come, hopefully, on that in the future.
Yeah.
So, as we mentioned before, there are several supplements for migraine. Magnesium, riboflavin, CoQ10 or ubiquinone, and D3 and ginger are actually kind of the 6 or 7 that are frequently cycled through and quite commonly talked about among the migraine community. And I, on the patient side, have been frustrated with supplementation because, one, it takes a really long time to notice if it's working. We're talking 2-3 months at a minimum of consistently taking it to find out if it's working. And that presents problems in and of itself, because if you want to see if something's working, much like an elimination diet, I feel like you have to start with just one, see if that improves, and then add another one, see if that improves. And then you wonder if it's the combination or the second one that you added. It's complicated, as everything is. And there are all other problems with supplementation regarding bioavailability of the different forms, and the form that you walk in is on the shelf at Target may not be the best. There's differences in magnesium is one. I think there's 6 different types of magnesium that you can purchase. Some can cause diarrhea and some can cross into the blood-brain barrier. There's just, it's really important, these distinctions in the different types of supplementation. And my final problem with supplementation is the quality of the research is low. Typically, it's very, very small ends if it's a clinical trial. I mean, I think there was a study that looked at clinical trials from 1960 to 2016, and out of 205 clinical trials, only 5 met the standards of double-blind, randomized, and placebo-controlled. So that's kind of the gold standard of what we want research to be at, and only 5 out of 205 studies for like 40 years met that criteria. And so I think this all being said is you have to listen to your body and really pay attention to how you are reacting. So that's my very long disclaimer when it comes to discussions about supplementation. So first and foremost, someone is looking at taking a supplement approach to helping their migraine. Do they need to get a blood test before they start anything?
Ooh, I mean, it's never a bad idea. Where I would say it is especially important and maybe even crucial to get a blood test beforehand is if you're considering supplementing with vitamin D. And even before I get into that, I do want to say, just like with over-the-counter pain medications, supplements, which any of us can buy, although there are like professional grade supplements that you do kind of need a prescription for, but those are the exception. They can have negative effects. They can interact with medications that you're on. They can interact with other conditions that you have. So I know it's kind of a pain, but it really is important to check with someone on your healthcare team first before introducing new supplements. It can be really helpful to avoid further problems. We don't need further problems. We want to find solutions. So just want to put that out there. But with vitamin D, which is like we kind of talked about earlier, it's becoming more and more popular as a supplement, and for good reason, because vitamin D has the potential to help improve migraine severity and frequency if we have a deficiency, along with things like mood, immune response, all kinds of stuff. But the thing with vitamin D is it's what's known as a fat soluble vitamin. So that means our body can store it So that gives the opportunity for an kind of an overdose or getting too much built up in your system, which is dangerous. So you don't want to take super high doses of vitamin D unless you know you need them, and you would know that through having a blood test done first. So long story short, especially if you're getting vitamin D or doing vitamin D supplementation, get a blood test done first to see kind of where you need to be with that. When it comes to other, vitamins and minerals like magnesium, riboflavin, B12 is kind of becoming more and more of an area of interest for migraine. It's still helpful, but like with magnesium, there is some research showing that even in the absence of a deficiency, it can be helpful. So it's not always about fixing a deficiency. Sometimes it's just people with migraine may have a higher need for these things. So it could still be helpful.
Right.
Yeah.
I think the other thing is that once you start a supplement, maybe 6 months later, then go get a blood test, see what your levels look like then.
Mm-hmm.
And one thing that I've discovered through just doing research, especially around magnesium, is that typically in these studies of does magnesium help migraine, they will look at magnesium levels before starting any supplementation in both the migraine population and the healthy controls. And at baseline, typically both groups are actually deficient in magnesium.
Yeah.
So that's perhaps maybe a safer one to assume that you are not getting enough magnesium just from diet alone. And because we can get into the whole standard American diet and how that doesn't always provide adequate nutrition, maybe another time, but that is one that I've seen pretty pervasively that is low. And that is one of the more established ones regarding a longer term history of being associated with migraine from a research perspective.
Mm-hmm.
And so one thing that I wanted to touch on, because this is something that I'm not super familiar with, is ginger. And you just made a post the other day about supplementation with ginger. And can you talk a little bit about that?
Yeah. So like most things, we do need more research on this. So it's another instance of seeing how it works for you and your body. But there are some small studies that show that ginger has the potential to work as well or similarly to some of our favorite migraine abortive medications. So that's interesting. That's some cool research, even though we need more of it to kind of point us in the direction that ginger may be helpful to not only manage episodes, but potentially in between episodes to help manage levels of inflammation in our body, because it is kind of an anti-inflammatory, and it even acts as a blood thinner, similarly to some of our like over-the-counter medications. Because of that, it's not going to be a good fit for everyone. So if you have, a bleeding condition, or if you're on blood thinning medication already, ginger may not be a good fit for you because it is a natural blood thinner. But it does have the potential to help with, migraine symptoms acutely. And it's one of my favorite supplements. It does work best if you take it early. If you are wanting to experiment with it, I take it even if I'm just thinking maybe I might be getting an episode, because it's food-based. So I feel a little bit better than taking a Maxalt, at every single inkling of a migraine episode, which sometimes is daily, right? But yeah, it's a interesting potential way to manage migraine symptoms for sure.
And I'm guessing there's very little risk of repeated ginger administration triggering medication overuse headache.
As far as we know, it doesn't do that. Yeah. To be fair, I don't know if that specifically has been studied.
Sure.
But it doesn't seem likely, at least at this point, that it would do that, which is good.
Of course, that was one of the hardest things for me, is overcoming medication overuse headache. And I think a lot of people don't even realize that they have it. It's not really talked about. I wasn't educated on it from a medical perspective from my doctors, and I think a lot of people aren't. But when you say taking ginger, are you taking pill form? Are you eating the root? Are you eating the ground ginger powder? I know you've mentioned tea even.
Yeah. So for myself personally, because I'll just talk about my own experience, I will use like a ginger tincture. So it's like a liquid, potent form of ginger. And we're looking for the like distilled ginger rhizome like stuff. We don't, we want it distilled and we want it to tell us like the milligrams that's in it. If you're looking for a supplement form, you don't have to use a supplement form. A lot of people use fresh ginger. And usually if you're doing fresh ginger, like a teaspoon of grated fresh ginger will give you a good amount that would be similar to what you would find in a supplement. When it comes to like the dried ground ginger, I typically don't love to use that therapeutically. Still great to cook with, still good to use, but it's not going to be quite as potent when we're talking about the therapeutic compounds that we're trying to get from the ginger because it's been highly processed.
Of course.
Yeah.
I think I would be excited. And I think this is something that I'm going to add in because I haven't really experimented with ginger. And I think maybe one of actually the first questions that I maybe should have asked when we started talking about supplementations was, you have these, we'll call them the big 5 of supplements for migraine.
Yeah.
Someone enters your threshold, raise your threshold program and isn't on any supplementation and doesn't know where to begin. How do you parse out all this information regarding their health and their history, their food, and start to figure out maybe what supplements will work for them?
Yeah, that's a good question. And it can be, overwhelming if you're trying to do this on your own, because there are, the main migraine supplements, and then there are a lot others out there, and there are combination supplements out there, there are proprietary blends and all kinds of stuff. So when I'm trying to figure out what makes the most sense for someone, I'm looking, first from a healthcare standpoint, I'm looking at their medications to make sure we're not going to run into any interactions. But aside from that, magnesium is probably the one supplement that I've found to be helpful for the most amount of people. And in particular, magnesium glycinate tends to be pretty well tolerated. It's one of the forms that isn't likely to give you diarrhea or an intestinal distress. Magnesium threonate is another great one, especially if I'm working with someone who does have a ton of like brain fog or cognitive issues, because threonate is that one form that can pass the blood-brain barrier, which is really cool. So I'll use that for someone who does have some of those additional cognitive issues. It has the potential to be good for anyone with migraine. It's just more expensive. So if we can save a little money on one of the zillions of supplements we're taking, then that's always helpful, right? And then I start to look at the other ones like CoQ10, which seems to be really helpful for people who also have light sensitivity, which is most of us. And then CoQ10 is another one that comes in different forms. So there's ubiquinone and ubiquinol. To be honest, ubiquinone is probably fine for most people. Ubiquinol is especially helpful if you have certain genetic mutations where you have trouble like interconverting the different forms of CoQ10, but ubiquinone is probably fine. It's used in a lot of the studies. And then the B vitamins, if I can, I like to do a deficiency panel to check and see what exactly do we need when we're looking at B vitamins and other, vitamins and minerals to see if supplementation makes sense, and to check for, are there gaps in what you're eating that we can also improve so that we're not having to rely on supplements forever, which is kind of the goal.
Absolutely.
Yeah.
I think it's fantastic that there are these symptomatic indications of what supplement may work for you. As you mentioned, light sensitivity, brain fog, that's phenomenal that you can look at your symptoms and say, okay, this is maybe where we should start. I think that was not clear to me from a patient perspective several years ago. And it's probably because the field is always advancing. Every year we're finding out more and more types of supplements, or supplements forms with higher bioavailability are continually to be discovered and produced. So this is definitely an area of treatment and hopefully research that will continue to grow. I am wondering, so supplements are not regulated, which is? not great.
Not mandatory regulated.
Right. So
Yeah.
my question is, are there 2 or 3, maybe just 1 or 2, if people can remember those, supplement brands that you trust?
Yeah. And I don't have any affiliation with these brands, but ones that I trust and probably use most would be Pure Encapsulations. That's a good brand. They make a lot of different supplements in a lot of different forms, so you can usually find what you're looking for. And then Life Extension is another one that I've been using more and more with my clients. It's another one that does third-party testing. They've got a lot of different forms of magnesium and some B complexes that are really helpful. And that's what I look for when I'm looking at supplements that I want to use and supplement brands, is I want that third-party testing. And that essentially means that the company has elected, because it's not mandatory, they've elected to have a lab that is not affiliated with them test their products for purity, potency, basically to make sure they're safe and that they contain what they say they contain, because not all supplements have in them what's on the label. And sometimes they can even have something that's completely just, you wouldn't even guess, like ground up grass and things like that, that you can actually be allergic to. So that's why, not to freak you out, but it is really important to get good quality supplements like Pure Encapsulations and Life Extension that use that third-party testing.
I will be very sure to put the links for at least those 2 and all the information regarding those in the show notes. Before I eventually saw an integrative pain specialist who knew a local pharmacy that was not a chain. It was this one-stop shop that had several like very specific brands of supplements that all had third-party testing, but a lot of people don't have a pharmacy like that near them. It was a very, very unique place, but going to something and purchasing something that you have trust in is a really great way to start with supplementation. At least you know what you're taking.
Mm-hmm.
So the last thing I wanted to circle back to that I think is kind of I don't know, maybe it's a politicized topic a bit, but that is functional lab testing. And then under that umbrella, like food sensitivity tests. We've mentioned it just briefly a few times. I have experienced people, I have never done them myself, but I have heard both sides of the aisle of the gospel, they're the Bible. Your food sensitivity is, if you're sensitive to garlic, you can never eat garlic again. And then I've also heard the other side and seen some research on they're not always very accurate, and it's also not your forever. So where do you stand in that great debate?
All of that is true. Well, almost all of it. So when we're talking about food sensitivity testing, there are a lot of options out there, and some are helpful and some are not helpful and can even make things more frustrating for you. So anytime I'm looking to do food sensitivity testing, I personally don't recommend like the IgG food sensitivity tests. I won't name any brands, but there are a lot out there. I think you can even buy them at Target now. It's just off the shelf. Which, I mean, on one hand is great that we're having, as patients, because I'm a patient too, that we have increased access to these kinds of tests, but we just want to make sure that they're actually going to be helpful tests. So the best ones that we have available right now to test for food sensitivities are what we call endpoint tests. So they're looking at kind of your cells' reactions to foods and food chemicals. So we can kind of get an idea of how many like mediators or inflammatory causing chemicals that your cells are kind of spitting out in response to foods. Even this is not a perfect test, which is why, like we talked about, you want to follow an elimination and reintroduction protocol to really figure out what's going on for you in particular. But when it comes to what to do with your results long-term, this is where root cause approach comes in, because food sensitivities are a symptom. They're not a root cause. So we want to figure out why your body is developing these immune responses to foods. Oftentimes, I mean, kind of always, it's a gut issue. So we want to make sure we're dealing with that, because that can help your body kind of start to lessen or even heal from some of these food sensitivity responses. And it's definitely going to help you not continue to develop more food sensitivity responses, which can be incredibly frustrating when you spend all this money on a food sensitivity test. You may even be working with a dietitian to go through a protocol, but you're not doing the root cause work. And then 2 years from now, you have a whole new list of food sensitivities. That is a bummer. So you really want to look at gut health at the same time as you're doing a food sensitivity protocol.
And would you recommend people be on supplements or off supplements when they're doing food sensitivity testing? Does that influence it at all?
That's tricky. So it won't influence the test necessarily. I mean, unless you're taking a supplement that has something in it you're sensitive to, which could happen. But when you're doing the protocol, it's really important to look at the ingredients of the supplements you're taking to see if maybe there is an inactive ingredient inside the supplement that could be on your list of foods you're sensitive to. Or, I mean, ginger, that's a food. So you could be taking that and be sensitive to it, which is also a bummer. So that's where you want to take kind of a critical look at your supplements to see if, there's anything that could be aggravating you. If it's just plain old magnesium, that's usually fine to keep taking, especially if it's been helping you, because we don't want to remove something that is helpful and make you feel worse when we're trying to make you feel better.
Of course. It sounds like if you're to the point of being ready for food sensitivity testing, it would be incredibly helpful to have a professional like yourself to sit down and look at the results of the endpoint testing, and then sit down with you and comb through all of the ingredients in your supplements, and then also look at all of your medications and see if there are any interactions or possible sensitivities hidden underneath, like the broad labels of magnesium or ginger, the fillers and things like that you could be reacting to that you won't even likely recognize the ingredients of.
Right. And you mentioned medications, and sometimes that does become an issue that we kind of just have to work through because medications are often dyed with, food colorings. We kind of sometimes have to take an imperfect approach to these things and just do our best, which is, always, we're never going to be perfect. So that's totally fine. But yeah, taking a fine tooth comb to your food, your supplements, what you're drinking, everything. Sometimes if you're really sensitive, it could even be like a lotion or a shampoo that's causing you problems. So it depends on how thorough you want to be and how much bandwidth, honestly, you have to be that thorough, because it is an undertaking. And there are kind of different levels we can approach it from.
I wholeheartedly appreciate the fact that you sympathize and understand that some of your clients and the patients that you see will simply not have the mental capacity to sit down and look at everything that is touching their body and everything that they're ingesting.
Yeah.
But the good news is that if someone is completely drowning in migraine and their disease is really impacting their quality of life, even looking at a small window of their life and trying to assess what you can improve there may help them level up in the quality of life. And as they continue to improve, then you can keep opening the curtains and look deeper and deeper and wider regarding shampoo, food, supplements, nutrition, holistically. So I think it's fantastic that you, and it probably comes from being a patient yourself with migraine, of understanding that when you're in the thick of it, your mental capacity for anything beyond taking care of scraping by is very small. So
yeah.
And I think that emphasizes the importance of having practitioners and registered dietitians and people on your treatment team who understand migraine really, really well, whether it's from a personal or just, if you can see a neurologist who's a headache specialist, that's going to give you that little bit of a bump up and having them understand what this disease means for your life.
Yeah.
My final question, because I just can't help myself because I've been thinking about it so much as we're rounding out this episode. CGRP. CGRP receptors, we know they're in this trigeminal vascular system of the face, and that's basically how we discovered that they help migraine. But there are also a ton of CGRP receptors in your gut. we know this very easily because a lot of people who take these CGRP monoclonal antibodies or the ditans and gpans, the small molecules, have constipation or gut issues after taking them.
Mm-hmm.
And my mind is just churning on as someone who was on both the monoclonal antibodies and the acute CGRP. Do you have any concerns of what this is doing to the gut? Do you think it's just temporary? I mean, there's no research. This is purely speculation, but from a
Mm-hmm.
personal perspective, am just so curious to hear from someone who has such an intimate understanding of the gut-brain connection, what your thoughts are around this. And to preface, I think the CGRP medications are incredible. They've helped me give me my quality of life back. I have no intention of stopping them, but I
Right.
do think about that every single time I take it.
Yeah. And that's honestly what I was going to say first is with any medication, we're looking at the pros and the cons. And I think it's important to ask for your doctor's time when it comes to this, when you're starting a new medication and asking them if they don't go over it with you, without you asking, what are the benefits of this and what are the potential risks of this? What are the side effects I could experience? What are the long-term effects that we know of at this point that I could experience? Because it's important for you as a patient to kind of weigh those with the help of your doctor and figure out, is this worth it for me? And with you and a lot of other people on these medications, yeah, it's worth it. But that being said, the GI issues that we can see with some of these medications, even just, short term, that the constipation that it can cause can be pretty profound and can have its own impacts on your health. So that is, kind of an additional barrier that a lot of people will have to overcome, or at least just manage, because it can be really hard to deal with constipation that comes from medications. Usually the best way to end that is to end the medication, and that's not always, what we want to do. So it is a concern because long-term constipation can come with other problems. I mean, worst case scenario, it can lead to impaction, and the issues that come along with that. So that's essentially you can't go and things build up. As you can imagine, that's not good. So, and then it can come with other issues like overgrowth of gut bacteria, because the waste that's supposed to be eliminated is just sitting in your large intestine and essentially providing food for your gut bacteria to just overgrow, which is not good. So yeah, it is a little concerning, and I'm hoping we have more research done over time to see if this is going to cause problems long term, even outside of constipation. Because like you said, CGRP, there's a gut connection there in itself. So we shall see, not to sound ominous, but we'll see what happens down the road, just like we have to see with any medication that's new, to see what happens in the years and decades ahead. But honestly, for a lot of people, it's worth the potential risk because the quality of life is so much higher, and that is totally valid and a good thing.
Of course. I think
Yeah.
this is all just to say, if you are having GI symptoms from medication, especially CGRP, talk to a registered dietitian about how you can help manage that. There are natural supplements and different foods you
Mm-hmm.
can eat to help improve constipation, and also talk to your provider, your neurologist, your headache specialist. Just because you're seeing them about your head doesn't mean that you shouldn't tell them about the rest of your body. Again,
Yes.
coming full circle of this is a holistic, like whole body gut brain connection, whole body ailment. And you
Mm-hmm.
can't just ignore shoulders down. It's
That's
everything.
right. That's right. Yeah, because constipation can be a neurological issue. It can be a nerve issue. It can be a motility issue. So yeah, your neurologist needs to hear about that too.
Which
Totally.
we're not taught. And you go to the neurologist for severe migraine, and the survey that you fill out is just about your head symptoms, your pain. Never are you, I mean, other than they have some mental health surveys now that you do in addition, and quality of life surveys, which I think are fantastic. But as far as pulling neurology into the whole body sphere, we're really not there yet in terms of like
Yeah.
strictly Western practitioners. Maybe if you go see a DO, that'll be a little bit different. And I think maybe MDs are getting a little more like comprehensive training from a few of my friends who are in medical school, but I think the large majority of people who are neurologists are just looking at your brain. And I've been to
Mhm.
neurologists and said, hey, I'm having all these hormonal symptoms. I'm having these GI symptoms. And I've verbally been told I don't deal with that part of the body. Very
Yeah.
frustrating, but emphasizing the importance of patient advocacy and saying, no, this is connected. Here's the research. I listened to these two girls talk on a podcast about it, whatever you need to do to advocate for yourself so that you do get that holistic approach to your health, for your
Yeah.
migraine, for your gut health. It's all connected. I think that's the
Mhm.
theme of the episode, but
Yes. Yeah, that's the theme of everything I do. It's all connected. And y'all, if you feel like your current provider isn't listening to you and isn't willing to maybe look outside of, you know, this, right? You can always get another opinion. There's nothing wrong with that. You need to click with your doctors and your dietitians and your, you know, whoever else you're using to help you through your journey. And there are a lot of us out there. So try someone else if you don't click and if you don't feel like they're of service to you. And you know, keep looking until you find someone that you like and who feels helpful.
right. And if there is not another neurologist, say you live in a small town and there's no one around you, the fabulous thing is that you can supplement your medical care with a registered dietitian and functional nutritionist and maybe talk to them through Zoom, you can do
Mhm.
telemedicine with them. They're very accessible. And so if you're in a situation where that, getting another opinion may not be feasible, right?
Yeah.
The good
Yeah.
news is that if you have internet and some kind of device, you can probably get the holistic approach you are looking for. You just need to look outside of your single individual practitioner.
Yeah, yeah. And that's a really good point. Thank you for saying that because it's not always as easy as I made it sound, right? Some people, you know, there's only one neurologist and maybe a headache specialist in their area, maybe not even that. So, yeah, that's a really good point. You can take advantage of all of the different providers there are out there. And I only work on Zoom. So there are a lot of people who will see you even if they're not near you.
And I will be sure to link all of your information, Instagram, socials, website, Raise Your Threshold program. Your knowledge base is clearly incredibly deep and wide, and I will funnel as many people towards you who I can, because if nothing else, having a preliminary meeting with you could be really insightful and just seeing if this is something that could benefit them. And
Yeah.
you're really out there to help people, which is phenomenal. And thank you. I mean, this hour has absolutely
Oh my
flown
gosh.
by. I've been, yes, so enthralled with this conversation. And I think this is probably one of the most jam-packed informational episodes we've done. And there's just so much to talk about. So I'm so excited to get this episode out and maybe we reconvene in a year and talk about all the new research.
Yes, let's do it. I'll see you in a year.
Excellent.
Awesome. Well, thank you
Awesome.
so much for having me. This was so
Yeah.
fun and it was a really great, stimulating conversation.
Thank you so much for your time. I
Yeah.
really appreciate you being here.
Awesome.
All
Thank
right.
you.
Thank you.